1895, Wilhelm Conrad Röntgen worked in his darkened Wurzburg laboratory. The Physical Institute of the University of Wurzburg was the site of the discovery. In his Physical Institute laboratory, Röntgen was conducting experiments with a Crookes tube, a glass vacuum bottle having electrodes at both ends. When he applied several thousand volts of electrical potential between the electrodes of the Crookes tube, he generated a new form of the electromagnetic radiation. This radiation could pass through body parts. When the photographic plate was exposed to the radiation passing through the body parts, bones and other innards of the body could be seen on the film. On the 22nd of December, 1895, what is known as the first X-ray picture and the radiograph of Mrs. Röntgen's hand. The world caught on to the new discovery. Public demonstrations gave the average person the opportunity to see his or her bones. As the years went on, many professionals believed there was no future in this field, admitting that they could see broken bones, but when it came to other anatomy, they were much less clear. Boy, were they wrong.
The best part about this program is you get to help a lot of different people and play a role in their recovery, and you get to make a lot of great friends.
I can't see myself doing anything else with my life besides X-ray.
I recommend it to anybody that wants to get into the medical field, loves working with patients. It's a great opportunity, and I don't think I would have chosen any other field. Well, I had already graduated in broadcasting, and I had a really hard time finding a job in that field that would actually allow me to support myself. So I knew that I was probably going to have to go back to school. I had already gone to a 4-year program, so there really was no reason for me to do that all over again. So I focused my attention basically just on 2-year programs. So I was on the internet researching, and I happened to run across radiologic technology. And I did all my research on it, and after reading up about it, I just knew right then, man, that's what I wanted to do for a living.
Donna Endicott is the program coordinator over at Xavier University. She has been in the radiologic technology field for 30 years now.
Okay, radiologic technology is really an art form and a science. They're two fields that are put together to image the human body. The radiologic technology field, it's an umbrella field that I think of that would involve diagnostic X-ray, CT, MRI, special procedures and cardiac catheterization. It's a new evolving field. I've been in the field since 1975, and there's always a new improvement in the quality of the images that we take, and always an area of advancement. Daily activities a student would do upon their clinical arrival day is just to make sure that the rooms are well prepared for patient care. They greet the patients. They are always able to find how to apply their classroom knowledge to the daily activities performed by a radiographer. They're always assisting the radiographer by positioning the patient, getting rooms ready for the patient, and actually performing some of the examinations that are required by the patient's family physicians and what they've ordered. To me, the best students that we have in the program are able to comfort the patient skills. And sometimes I know our field is so technical at times, students really need to be able to calm the patient at all times and to assist them in any of their needs. The typical academic and clinical training portion of students training their curriculum would normally involve a lot of sciences and the social sciences aspect along with the radiologic technology curriculum.
The good thing about radiologic technology is that you play a major role in the patient's healing process. You get to know these patients, you get to deal with them, sometimes on a daily basis. And when you go home at night, you just feel really good about yourself. The thing about getting into the medical field, especially radiologic technology, is that it's not just limited to just x-rays. You can go on, you can do medical cells, you can do pharmaceutical cells, you can do special procedures, you can work in the cath lab, you can go and be cross-trained to MRI or CAT scan, and even become a manager of an x-ray department. There's just so much you can do. It's just a plethora of opportunities out there for you.
Hi, my name's Steve Amman. Welcome to X-Ray 101. I'm going to show you a basic chest X-ray. The first thing you need to do is to put your film into the bucky. We make sure that it's into the right slot. Place the film in correctly. Then I adjust my vertical bucky up and down before I position my patient. Okay. When I position my patient, I want to make sure that I get the apices.
APCs, the upper portion of the lung field projected above the clavicle.
Into the film view and centered. Okay, once I have my patient in position, I align my tube head with that and align my crosshairs to the center of the area that I need to focus on. The next step is to go ahead and set my technique for the patient depending on his or her body habitus. Then the next step is to give breathing instructions to the patient. Go ahead and take in a deep breath, hold your breath, and then I give the exposure. So when the exposure has been completed, we are using a CR system, a computed radiography system. We would enter the cassette into the system here, the smart reader, and then the smart reader would go ahead and create a digital image right on our screen here that we're able to check to see that we make sure we get the apices in the picture, we get some vascular markings, we also see the costophrenic angles, and you can see some of the vertebrae in the center. That way you know that you've got a technique set properly. And that's all there is to a basic PA chest X-ray. Hello, my name's Steve Amman, and I'm going to show you some X-Ray 101. Hi, my name's Steve Amman, and I'm going to show you X-Ray 101. Hi, my name's Steve Amman. Welcome to X-Ray 101. I'm going to show you a basic chest X-ray.
I like working with patients and...
Stop. You gotta make sure you look over here, okay? Go ahead.
The best part about this program is helping a bunch of patients. That's the get started.
Learn all about them. Stop. Blah, 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 blah. 1, 2, 3. Well, I had already graduated in broadcasting, and I had a really hard time finding a job in that field. That was blah, 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 blah.